Welcome, viewers, once again to another edition of the Manifest Direction. Quite an exciting edition, if you like. If you've been following us, whenever we have a guest on the program, it's an expert, it's a subject matter expert, and we take out the best in them to educate and mentor the public on the issues. I'm excited because today we have on the show Chief Godwin Iyaku, a friend, a colleague, a former insurance expert, somebody who went around Africa in at least 5-6 countries together planting. I was planting banking, he was planting insurance. Now he's back serving the state, the government of Portugal, and they are doing social insurance. Chief Godwin Iyaku, good to see you again and welcome to the Manifest Direction.
Thank you, my brother. Good to see you.
So what is this thing about social health? There's a lot of talk about social health. You may want to educate me and our viewers what social health entails.
Thank you very much, man, for that question. Social health insurance is simply a health insurance scheme designed to make healthcare affordable and equitable to all the citizens. Now, healthcare is not very cheap, but with the introduction of social health insurance, you are sure going to take care of the vulnerable population free of charge. You are sure going to distribute health financing to all and sundry, purchasing health with minimal money, and ensuring that the health available is a quality one. That is what social health insurance is all about. With social health insurance, you are sure going to get across to everybody. Everybody sleeps fine, everybody sleeps well, everybody believes that he or she has insurance and healthcare to attain all the time.
Thank you very much. It sounds interesting to me because if you remember in the late 2000s when we were in East Africa, I found it exciting that both the gardener, the security man, could go to the same Nairobi hospital as the president, the prime minister, then would go. So maybe he had to do with that equitable distribution. Now, what would you encapsulate as the benefits of health insurance?
Thank you so much.
Social insurance.
Yeah, we are Africans, and our resources to purchase health is very, very, very limited. So therefore, the benefits of health insurance are myriad. You have access to health care, to take care of your basic ailments, to take care of your vertical ailments, to take care of your terminal ailments. You know very well that accessing health care, once you know that you have access to health care, the psychological aspect of the sickness is about 50-60% achieved.
True.
That is what health insurance, or social health insurance as you call it, is achieved. Right. What you saw in Nairobi is the social health insurance. Right. It is working perfectly well in a country called Rwanda today, where the vulnerable population is catered for with state funds and donor funds. 0 to 5% to 5 years, the aged persons, the pregnant women, all access health care free of charge. That is what is designed in Nigeria, what National Health Insurance is practicing right now. And all the states of the Federation have been advised and they have adopted it. And every state health insurance agency now operates that. Now I have been an avid follower of the Manifest Direction. The very robust programs of the Manifest Direction keys into this, perfectly well into this health revolution that is called universal health coverage.
Thank you.
Universal health coverage is a slogan, it's a design that encapsulates every country. It's a United Nations health program to make sure that no matter your status in society, you achieve health care. And so what Manifest Direction is doing is in that direction.
Thank you.
The health of the people is the wealth of the people or a nation. And that is what Manifest Direction wants to enthrone.
Right.
Therefore, embracing the social health insurance is the right direction to take. In that way, you are ensuring that the vulnerable, those who can achieve the weak, is strong. And it's a system designed to get from the strong to take care of the weak, to take from the rich and take care of the poor. That contribution that we give as the rich or the strong persons is spread across to take care of purchase health for that person who is weak or who is poor. By so doing, everybody has access to healthcare. And Manifest Direction is directed towards that direction, if I may use that language. And I must commend you and urge you to go ahead. If you do that, there are several development partners who are willing to partner with you to ensure that this goes to every nook and cranny. And as it is, as you go ahead, you will develop a very robust literature to include what we call the adoption platform. Politicians nowadays go to communities or to their constituents to distribute motorbikes, distribute some foreign things to empower the people. But in this case, I will urge the Manifest Direction to buy healthcare for its constituents. Once they are healthy and access healthcare, the population booms, they become strong, and it leads to productivity.
Right.
And by so doing, we would have achieved their lofty desires of bringing about the dividends of democracy to the people.
Thank you very much. Quite exciting, Chief Iyala. If I know you've started businesses grounds up, I know that amongst the 36 states of the Federation, you were one of the earliest appointees to handle that bucket before the other states joined. I also know that you did a program in that bucket and invited me to come and talk there. You coordinated the program for your colleagues across the state, and it was quite commendable. So, if you were to advise from grounds up, from zero, from greenfield, how would you then go about surmounting the issues associated with embracing the social health program?
Thank you very much. It's the same thing as building a house. You have to identify where you are going to build a house. You have to have a solid foundation. The structures have to be solid. You build and have a very sound roof on it. And then for you to go there, stay fine, you have to do landscaping to make it beautiful. That is the same thing with social health insurance. It is built on several pillars. You have to know exactly the people you are designing it for. You have to do what is called benefit package. That is when they enroll into health insurance, what kind of healthcare are they going to access at all? So the benefit package has to be robust to take care of basic ailments and vertical diseases, those that consume them or can give them psychological heartache. You include it in the benefit package so that we know that what they are buying, they have everything to benefit from it. From there, you do your operational guideline, and then you do other things like that to make it, give it, fleshing it up. And then you design your premium, which has to be affordable. Mind you, health is a necessity. And when designing it, make sure that it is compulsory for everybody. It is not something that is optional. Even national health insurance that was designed to be optional, that law has been phased out to make it compulsory. Once you make it compulsory, you have to make it affordable for everybody. So when you put all those architectural guidelines in place, you have a very robust social health insurance. Then you reach out to start marketing, you segment, you build the claims area, you build the marketing area, you build monitoring and evaluation area. It's something that you have to always be up and doing to ensure that you are right and the people are in order. You identify exactly what they want. In some cases, you have tropical diseases. In some cases, you have some ailments. Your benefit package is the Bible that you need to ensure the robustness and the success of the social health insurance scheme. Because if I buy it, and I see that if it is malaria, if it is headache, if it is that thing that is prevalent, it's covered with minimal amount or nothing at all. You purchase healthcare all year, all day, every month. You have access to healthcare, presentation of your card of enrollment, and you access healthcare and you go home free of charge.
Right.
So it seems. Thank you.
Excellent. Thank you very much.
Thank you.
We promised that it was going to be outstanding, and we are very confident that you concur that Chibi Yala has delivered.
Thank you very much, my sir. Always my pleasure.
Thank you.